Hi, good night. How are you guys? Today, my name is Adeleke. I'm going to be going over structures and anatomical structures that relate to the shoulder. This is a review for OMM session for class of 2012. We will be going over structures that we're going to be doing using techniques to evaluate patient during our regular history and physical. And I'll just be showing you guys some major structures because I think it's a little bit more visible if you guys see it on the skeleton. Thank you very much, and let's get this started. So, this is Bob. I'm going to try to make this as interesting as possible. So hi, Bob. First, we're going to start with anatomical structures. I know you guys won't be able to see the muscles, but I'm going to try to demonstrate them as much as possible. I'm going to start with the superficial back. As we all know, we have a bunch of muscles, just a few ones. We have your trapezius muscle, right? Which is the first muscle I'm going to illustrate where its origin insertion. And guys, let me tell you something real quick. This is extremely important. For any muscle to work, it has to cross a joint. That's the basis of origin insertion. Don't freak out. This is the easiest thing possible. I know I might sound crazy, but if you know where it crosses, it's like, just think about it. If I have something that crosses a bridge over here, it has to be able to make its function by bringing these two structures together. If it originates from here and ends here, it can basically perform its function. And that's what origin and insertion is. Very, very easy if you just start taking a look at it visually. So, starting with the trapezius muscle. We all know the trapezius muscle is a V-shaped, right, triangle like a diamond. And as we can tell, it starts right here from the superior knuckle line of the occiput, right? That's where it originates. And it also originates from all your cervical vertebrae, right here. You have your C1 all the way to C7. Also continues from T1 all the way to T12. That's the origin of the trapezius muscle. Now, it has to insert. So it's coming like this and making that diamond shape. So it's already inserted all the way, stabilized here. Then it has to insert to the lateral part of the clavicle, as you guys can see right here. Also can insert to your acromion and also to the spine of the scapula. So what nerve innervates the trapezius muscle? Everybody knows this. For a patient to come into the hospital, you tell them to shrug their shoulders. So if I shrug my shoulders up, basically I'm elevating my scapula a little bit, and basically you have your spinal accessory nerve that basically come out from the jugular foramen from the skull, if you all remember from neuro. And that's basically the nerve that innervates the muscle. And we're done with the trapezius. Let's move on to the next muscle. It's another superficial muscle which originates, which we call the Latissimus Dorsi. I'll tell you a little story about Latissimus Dorsi. The Latissimus Dorsi, I think, is this big muscle at your back. Really big. So it looks like a bowl. And what do I mean by a bowl? It basically looks like it's sitting here like at your back. It forms like the palm of your hands. So think of this as having a meal, like a meal, which M-E-A-L. So the mnemonic for Latissimus Dorsi is going to be M, which is going to medial rotation, E for extension, A for adduction, and the L is for the lats. Can't get easier than that. You get what I'm saying? So you just got one entire muscle with three functions out of the way. You feel me? Good. Now, look at the lats. It's this big muscle. It's going to originate and start basically from about T7 all the way to T12. And there's this thoracolumbar fascia that's covering from your lower thoracics and onto your lumbar, and also attaches to the iliac crest right here, so you guys can see. So the muscle is coming all the way down. By the way, also attaches all the way to ribs 9, 10, and 11, and 12. So 9 to 12, guys. Remember that. Now, what does it have to do? It has kind of have to go all the way in and attach all the way to the base of the floor of the bicipital groove. So this is what the muscle is doing. It's coming all the way right here and just doing this. Think about it. He just crossed a joint. So when he wants to extend, he can do this, right? That's the extension part. If he wants to pull you in, it allows you to adduct. And when you want to pull up muscles, so everybody goes to the gym, and you have to pull down like this, right? That's the function of the latissimus dorsi. It's helping you adduct. All right? And guess what nerve will innervate this muscle? That will be a thoracodorsal nerve. And that's it. Just to reiterate, it helps you medially rotate, right? So this is medial rotation, right? And it helps in adduction and also helps in extension. All right? So, and that's your latissimus dorsi. So we've covered the superficial muscles of the back. Now, let's move on to the deeper muscles. So I'm going to reflect, basics from anatomy, if you guys remember. We reflect the muscles. Now we can see these two beautiful muscles that stay right up here. We have the rhomboids minor and the rhomboids major. Your rhomboids minor, obviously, it's a very little muscle. It starts about C7 and T1. You know, just little, that's where it originates. And they should insert on the medial border of the scapula, right here. You have a teres major, which is this, I call him his older brother. He starts from T2. Rhomboids major. We start from T2 to about T5. And basically the muscles are doing this. So if the muscles stay like this, and they also insert on the medial border of the scapula, they help you what? In retraction, right? Of your scapula. So they bring the scapula together. What nerve innervates the rhomboid major and the minor? They're called the dorsoscapular nerve. Hopefully you guys remember from anatomy. And that's it. Look how easy this thing. It starts from somewhere, it goes over to the other side. It's kind of like the Lincoln Bridge over in New York City. Or, you know, you have, so basically it's bringing two structures together. And that's origins and insertion. Let's talk about the levator-scapular muscle. Like the name gives it away. Levator-scapular. It's originating all the way from about your transverse process of from C1 to C4. Right about here. Then it comes all the way down. It's just this thick band of muscle, right, and inserts to the superior medial border of the of your scapular. And basically, what does it do? It helps you elevate your scapula. So it's kind of, when it contracts, it pushes the scapula together. So what nerve innervates it? I give it away the first time. It's the dorsoscapular nerve. The same exact nerve. Think about it. If the muscle is sitting right here, and you have another muscle sitting right here, they got to be innervated by the same nerve. All right? So we've covered the superficial muscles, and we've covered the deep muscles of the back. Now, I'm going to go over the deltoid muscles, because they are very, very important. Now we're going to the shoulder. Now, when we get to the shoulder, we have the deltoid muscles. The deltoid muscle is this, nice, big, well-defined muscles that sort of kind of covers this aspect of the shoulder. And it has three heads. It has the anterior head, which is right here. It has the middle head, which is in the middle. It has a posterior head, which is at the back. And we're going to learn what the deltoid does. So, but let's start with the origin insertions. People think this is actually difficult. It's not. If you kind of look here, this is your clavicle. This is your acromion. This is the acromioclavicular joint. This is your coracoid process. Now, the anterior head definitely has to be here. So guess what? I gave it away. It's starting from the lateral aspect of the clavicle, right? Sort of kind of covering part of the coracoid process. And it's going to join with its friends, which we're going to talk about where they insert. The middle head has to attach definitely to the acromion. And the posterior head has to attach to the spine of the scapular. Usually probably the lateral distal third of the spine of the scapular. They basically form a big bunch, and look, they just look like my hand. They're going to insert to something called the deltoid tuberosity. There's a nice little bump here, and that's called the deltoid tuberosity. Let me take you back in anatomy. Now, what nerve innervates this muscle? Remember for the brachial plexus. God, that doesn't sound right. Yeah, the brachial plexus. That's what they're making us do now. Indirectly. Hey, thank you so much for watching the video. I hope you learned a lot. Are you studying for the USMLE Step 1 or Step 2? Are you studying for the NCLEX, or you're currently in nursing school as a nursing student? Are you a PA student currently in school or studying for your PANCE exam? Or are you a nurse practitioner student
or trying to take your MP board exam, listen, I've got super awesome content for you. If you truly love this video and it simplified your learning process, I want you to check out my website below. I've listed all the list of exams, whether you're studying for any of this board exam, and all I want you to do is click on the link right now below so that you can take you directly to my website. For USMLE, just go to smashusmle.com. For NCLEX, go to crushnclex.com. And if you're studying for the PANCE exam, the nurse practitioner exam, or you're studying for your internal medicine board exam, just click below and it'll take you directly to ftplectures.com. Listen, I can't wait to help you. If you need to get in touch with me, just get to my website, be able to reach me directly, and we can work together one-on-one. Listen, you're super awesome, and my goal here is to help your dream come true. If you want to be a doctor, want to be a nurse practitioner, a registered nurse, or physician assistant, I'm here to help you get to that next level. With your medical knowledge, let's save the world together. I love you guys. You guys are super awesome, and do not forget to click on the link below to be able to get to my website. Also, don't forget to subscribe to my channel. You guys have a great day. Let's go.